to $200,000 a year. Very expensive, right? Do you know that there are many options for you that you can choose so you can get affordable and high quality care? Well, today it's a very special episode because we're gonna talk about how to find the best quality care and affordable options in cancer care in the Philippines. If you don't know me yet, allow me to introduce myself. My name is Wanda 𝐀𝐁𝐎𝐒𝐓. This is the Cancer Conversations with Coach Wanda. Every week, I go live interviewing healthcare experts, cancer survivors, and also caregivers and partners to shed light, give life-saving insights so together we can prevent, detect, and cure cancer. If you're joining us live or on replay, thank you, thank you, thank you. I would love to know where you are joining us from. If you do want a specific episode for us to do, please drop in the comments below and we would love to feature that. And if you missed the last few episodes, please go to Linktree Coach Wanda to watch that. But before I bring my very special guest on stage, let me walk you through what are the previous episodes of the Cancer Conversations with Coach Wanda that you missed. So on our first episode, I'm very blessed to interview the first Emirati UAE national breast cancer surgeon, Dr. Huria Kasim. We spoke everything about how to prevent, detect, and you know, cure breast cancer. She said on this episode how every woman, specifically those age 40 and above, need to have regularly check because a lot of women are getting breast cancer. It's common, but it's getting treated effectively. So go to Linktree Coach Wanda to watch the recording of that episode. On the second episode, I'm again very blessed to talk to Dr. Romy. For the last 20 years, Dr. Romy have worked with over 24,000 patients, and he was able to help a lot of cancer patients to heal holistically. It's not just about medicine, right? Dr. Romy spoke about how to heal cancer from within by finding what works for you, trusting the process, listening to your body. If you want to know more about Dr. Romy, he has a program called How to Heal Cancer Holistically. You go to wellnessland.org to find more about his programs. And again, if you want to listen to this very interesting episode to understand how cancer or any sickness can be healed holistically, go to Linktree Coach Wanda to watch. And then, of course, I would like to thank the 300 plus attendees that we have for that episode. And on the next episode, I'm again very blessed. One of my staff, Roslyn, shared her cancer caregiver journey as she helped the husband for the last 8 years manage the cancer. So cancer caregiving is a very complex journey. This is from my personal experience, and I'm very blessed to listen to Rose as she shared tips and tools how you can take care of yourself so you can take care of your families too. So watch the recording of that episode again on Linky Coach Wanda. On the next episode, I'm very blessed. On episode 4, we had 317 interested attendees on LinkedIn who registered for that. Coach LJ is a very great coach because she shared tips and tools you can immediately apply, like holding your hand just to calm down the stress, the anxiety. Because what she explained on this podcast interview is how every negative emotion that you have, guilt, shame, sadness, is making you sick. And unfortunately, the number of negative emotions that you have piled up, and then you become sick. But cancer and every sickness can be held emotionally. Listen to the recording. We have a YouTube recording of the podcast. It's also available on LinkedIn. But every week we go live on LinkedIn, Facebook, and Instagram. So again, go to Linky Coach Wanda to get access to the recording of that episode. On episode 5, wow, another very interesting episode. On this very, I'll say, inspiring episode, I had the pleasure to interview George Takianos from Australia. At age 31, he was diagnosed with cancer all over his body. Only his bone marrow didn't have cancer. The doctors gave up on him, but he was able to survive and even overcome cancer. At 39, he even had a brain injury. But at 47 now, he was able to live the healthiest, happiest version of himself by living his authentic truth, by having a champion mindset. He was always saying that, It's about having a healthy mind, body, and following what works for you. And of course, listening from the right people and guiding them. So go to LinkedIn Coach Wanda, and I would like to thank those 354 people who were interested in watching that podcast interview with George Takianos. If you're finding it difficult to live life every day, listen to George's story because she shared a lot of tips and tools that can help you find more joy and meaning in your life. Now, on episode 6, wow, do you know that there are many health tech companies, fintech companies for that matter, like TajPay in Jordan, they are transforming healthcare payments because we know how much healthcare is very expensive, right? But there are companies like TajPay, which is like the Tabi of healthcare, because you can, have zero interest on your healthcare payments, and TajPay will take care of that for over 1 year now. They help over 592 patients. If you want to learn more how TajPay is transforming healthcare payments in Jordan, well, listen to that podcast interview with Liwa Abokate. And also on episode 7, this is again one of my favorites. There's so much technologies that's available now for cancer to get detected, prevented, and cured. And one of that is genome testing, liquid biopsy, and so much more. And I'm very blessed to partner and, talk to Dr. Kapoor, who explained this kind of test in a layman's term that any person can understand. There's so much technology that's available now that you just need a few blood tests. Sometimes you just need to spit, and then they will right away know whether there are chances of you getting cancer or you're sick. So please do watch this episode. Go to Linkly Coach Wanda to get more an understanding of how BioAr's advanced testing is transforming cancer care and diagnosis. So thank you for those who are watching us live or on replay. If this is your first time, I would like to personally invite you to tune in because there's so much that we will cover today. On episode 9, well, I I'm very blessed again to interview another cancer overcomer. She said, I don't want to be called the survivor, Wanda. I want to be called a cancer overcomer because Janita Green is a certified public accountant in the USA. And for 2 times she overcame cancer. So now she is helping people find the light in the darkest days, and listen, get inspired, find hope in this interview with Janita Green. Again, go to Linktree Coach Wanda for that. And on episode 9, well, we are again very blessed because we have another very important expert on the show where Dr. Neil shared about how palliative care is enhancing the quality of life for cancer patients. There's so much options now available for healing life, but palliative care is one of the options, and a lot of people don't understand what it means. So on this episode, we deep dive down on what palliative care is about, why is it important, and how to get the right palliative care for any family member who is not feeling well. And and let me read the bio of my guest before I bring her on stage. Dr. Denky Dela Rosa is a medical oncologist at St. Luke's Medical Center Global City and UERMMMC. She has over 20 years of experience diagnosing and treating various types of cancer. She is known for her dedication to advancing cancer care and improving patient outcomes. Dr. Denki's commitment to her patient goes beyond the clinic as she actively engages in cancer awareness initiative and advocacy efforts aimed at educating the public about prevention and early detection. Well, Dr. Denki have over 19,000 followers on TikTok, so you can understand the massive kind of work that she does to educate people. She is passionate about providing personalized care that meets the unique needs of every patient and their family, ensuring they receive comprehensive support throughout their treatment journey. And most importantly, Dr. Denki believes that cancer management is not about pushing one treatment after another. It's not about introducing new technology and developments and depleting the resources of the family. It's about coming up with a plan that, with the balance, will need to prolong the patient's life and preserving the dignity of the family and the patient. Wow. So I'm very, very excited. Let's bring Doc Denky on stage. Doctor, thank you so much for saying yes to this interview.
Maraming salamat din, Wanda. Thank you very much for this invitation. It's actually an honor also, no, on my part to be sharing the stage with you, being the most influential Filipina on LinkedIn. Wow.
Well, thank you, Doc. But I think it's not today. It's not about me. It's about you sharing the story of how to find, the high quality and affordable cancer care in the Philippines. And Doc, before we talk about that topic, I want to understand first your beginnings. I know you've been helping patients for the last 20 years, and I would like to understand, how did you start to choose that, wait, I want to be an oncologist, or I want to help cancer patients? I mean, can you guide us in terms of your journey to being an oncologist?
Yes. I was about 5 or 6 years old when that quote unquote decision was made to become a doctor. Um, it was like, there was a situation wherein I thought back then that my dad was sick, and being, a daughter who wants to take care of her dad, I just blurted out, I want to be a doctor. And it was something that was repeated to me day in, day out of my dad. And, I grew up really believing that I wanted to become a doctor. But I never ever expected or even imagined that my specialization is going to be about managing cancer patients. I think this was brought about by the burnout that I experienced when I was training as an internist, and we had this doctor. Dr. Gracio Fernando, who was very, very passionate and eloquent when it comes to managing cancer patients. And I would always tell him that he was actually the inspiration for me choosing to become an oncologist. No? So every time I'd be in trouble or experiencing some stress from my profession, I would always jokingly tell him, "Sir, this is all your fault why I became an oncologist."
Wow, that's such a story, Doctor. But I mean, in my 100 plus podcast interview, I've learned that the most successful people had clarity from beginning what they want to be, and they have the mentors, and you do have both. So it's good to know that from childhood, you do wanted to help your father, which actually became a career, and you have the right person who's guiding you. Wow, that's such a gift. So now, before we start, if you want to be successful in your career, that's what I always said. Get clear what do you want to be when you were younger. Find that path and also find the right mentors, right, Doc? Now, look, let's go straight to the topic itself, because, I mean, when my mom was diagnosed with cancer, it was a total shock for the family. Now, while doing research, I learned how National Cancer of Institute said that 1 in 3 women will have cancer in their lifetime, and 1 in 2 men will have. So it's such a scary topic, right? But I think it's time to shed light on what's really the problem in terms of why are we having cancer. I mean, from your 20 years of experience, can you at least find what are the commonalities that you found in patients why they are getting cancer?
Yeah, that's actually a very good topic to explore. There are many answers to your question as to why people seem to be, or why more people seem to be getting cancer. One of the reasons is because our generation, we are actually living longer. If you can
Mm.
imagine in the 1800s or even earlier, a lot of the people will actually die of infectious diseases.
Oh.
Diseases like malaria, tuberculosis, leprosy are actually conditions that people die from way back then, before antibiotics became available. But nowadays, these diseases that I have mentioned are actually very, very easy to manage. In fact, for tuberculosis, our government has a DOTS program, direct observation treatment for tuberculosis, wherein patients can actually get their medicines for the entire 6 months for free, as long as they enroll themselves in a government program. No? So that's one of the reasons why people are actually living longer, because we are able to hurdle infectious diseases that come our way. Another thing is because we already have very sophisticated technology. When I was in training, the CT scan was actually very slow and would take 30 minutes to an hour at least to finish the entire section of the lungs. But nowadays, CT scan is actually just less than 5 minutes. Um, so technology is actually advancing. We have more mechanisms to identify cancer. A very good example of that is the PET scan. When I was starting my practice about almost 20 years ago, it was only St. Luke's Medical Center that has a PET scan in the entire Philippines. But nowadays, you actually have many, many other institutions that has the PET scan available. So there is a compilation of reasons as to why cancer is or seems to be more prominent. And of course, another thing, I would always tell people that we have no choice, but we live in a very cancer causing or carcinogenic environment. No? There are a lot of things in our environment that if you look at them, they would seem like it's a small thing, but when they keep on piling up day in, day out, and we've been exposed to these different things for many years, that's actually when cancer begins. No, there will be some literature that will say that cancer is actually a disease of aging. Cancer is a disease of wear and tear, wherein as we grow older, the risk of developing cancer can actually increase. In fact, even for vegetarian patients, I have patients who have been vegetarians, they're not necessarily immune from developing cancer.
Wow, doctor, I think that's enlightening, right? Because as you rightly said, I think we need to go back to evolution and think of, there are many causes of it, but because of the advancements in technology, I mean, the statistics have changed too, which explains the cause. But doctor, I think that's one of the worrying things also when you said that, being a vegetarian doesn't exempt you from getting cancer. I mean, because a lot of people think that, oh, I have a healthy body, or, I'm eating healthy, I'm exercising, I'm gonna be free from any sickness. Now, doctor, you explained something about carcinogenic environment. It's kind of scientific scientific term for me. Can you explain? Because I think if we, at least from a layman's perspective, understand what are these factors that contributes to getting cancer or getting sick. Can you explain what are those things?
Yes. One of the most common questions that patients would ask me, Doctor, why did I get cancer? Uh, and of course, it's very difficult to identify a single or a few items that can point to why this patient developed cancer, because cancer is what we call a multifactorial disease, meaning it's a combination of the genes, of the environment, of the lifestyle, of the food, of the conditions that the patient may have encountered that eventually lead to the development of cancer. So, not all people with a family history of cancer will develop cancer, although, of course, their risk is higher. There are some lifestyle choices that they can actually take into consideration or adapt in order to reduce the risk of developing cancer. No? So, what are some of the examples of these? When I say carcinogenic, it simply means that it's cancer causing. So, what are some of the examples of the cancer causing entities, things in our life? Of course, everybody will always say that our diet. Our diet is one of the factors that will may contribute to the development of cancer. But when you search about the best diet for cancer or to avoid cancer, you are actually going to be bombarded by a lot of confusing information. There are some camps that would advocate a vegetarian or a vegan lifestyle, plant based, no animal protein. But on the other camp, there are people who are advocates of a ketogenic diet, which is almost the opposite of a vegan or a vegetarian lifestyle, which espouses a very low carbohydrate diet but relatively high in animal protein. There are some literature that will say that animal protein is actually one of the culprits for the development of cancer. So it's going to be very, very confusing. Okay. Other things in the environment that can contribute are, for example, all of us are exposed to our laptops day in, day out. Our laptops, our phones, our iPads, and they say that these gadgets actually evoke some not necessarily radioactive material, but some electromagnetic waves that may contribute to the development of cancer. However, we cannot, millions of people around the world are exposed to their computers every day, but not everyone encounters or develops cancer. Not everyone who uses their computers the whole day eventually develop cancer. So there are factors that are inherent within the person that perhaps when it interacts with these things in our environment may lead to the development of cancer. So, as far as I'm concerned, it's impossible for us to really eradicate all these things. What we can do is actually just try to minimize, try to, lessen our stress, be able to adapt to all these different things that are thrown our way, and we need to let go of our need for control. No? A lot of
Hmm.
the questions of asking doctors about how to prevent cancer, there is that, a certain percentage of that has something to do with control. It doesn't mean that, just throw out everything and enjoy without restraint. But the fact remains that we can do our very best, but at the end of the day, we are all dependent on the mercy of God and what God wants for us to have or experience in our lives. No, life is actually very enigmatic, mysterious, many things that we don't know. So it's really very difficult to explain, but we can just give some glimpses of information that will help some people to try to understand and grasp the reality of the situation.
I love that explanation, doctor, which actually ties up. I mean, I had an interview with Dr. 𝐀𝐿𝐄𝐒𝐓, a breast cancer surgeon here in the UAE. She's the first Emirati national who's the breast cancer surgeon. She said on that interview where there's really up to date, no exact, to pinpoint the why. It's kind of difficult to explain the why. And I think your exact definition of multifactorial explains it all, that there could be many, many reasons for that. And I remember also in one of my interviews, Dr. Kapoor said that, you know, every day you don't know you're eating plastic. So subconsciously, some of the things that you're doing are making you sick without you being aware. And as you explained, maybe also the gadgets are making, some electromagnetic effect on your body too. But I think it's about understanding, your body too and listening to it, as what Dr. Ronnie said. Now, I I know cancer, doctor, is one of the most expensive sickness because on average also it costs $10,000 to $200,000 a year. Now, in terms of cancer cost and treatment, doctor, I know, I was doing my research, for example, in Canada, in US, in the I mean in here in Dubai, the Tagriso medicine for lung cancer is like $10,000, but in the Philippines it's only $6,000. India also is cheaper. Now there are varying costs in terms of treatment, doctor, and I think from your experience, what are the other challenges that cancer patients are facing other than the cost of the cancer?
Yeah. Here in the Philippines, many of our cancer cases because healthcare is mostly out of pocket, are diagnosed at advanced stages. And it is ideal for cancer to be diagnosed at early stages because this is when cancer is most curable. Cancer is most curable when it has not yet spread to different parts of the body. That is when you can apply different strategies because when a patient is diagnosed with cancer, the patient usually requires multiple doctors. To give you an example, even for patients with lung cancer, when the cancer is caught at an early stage, patients are supposed to undergo surgery. And therefore, you need a surgeon in order to perform the removal of the cancer, plus or minus the lymph nodes from the lungs. And then, after the diagnosis or the surgery, and by the way, most of the time, these patients will actually present to a lung doctor because a lot of these patients may be presenting with cough or chest pain or sometimes difficulty breathing. And therefore, for lung cancer patients, majority of the time, the initial contact of the patient could be with a pulmonary doctor because of the symptoms that can be brought about by the presence of the tumor in the lungs. So even for lung cancer, which most often presents at an advanced stage, if we catch the cancer at an early stage, um, the patient will already be requiring many different doctors. So, number one, I mentioned the surgeon. Number two, the medical oncologist who may need to give the patient either tagriso or chemotherapy as an adjunctive treatment, and some other patients may be requiring radiation therapy after the surgery. So, you will see that patients actually require different doctors. Um, so because of the uh, involved cost of managing a disease, patients who are paying out of pocket tend to postpone seeing their doctor in the hopes that the condition is going to disappear or get better. Here in the Philippines, it's very common for patients to go to the drugstore and just ask the pharmacist or whoever is manning the pharmacy and ask them, I'm having cough. What medicine can you give me for cough? But in reality, that's not how we address a patient presenting to us with cough. You need to be able to get a very thorough history of the patient to identify what is the potential cause for the cough. And you also need to be able to identify and do a physical examination in order to arrive at a tentative diagnosis. No? So, one of the challenges, of course, you know, as I've said, patients present at an advanced stage, and when the patient presents at an advanced stage, the higher the stage of the disease, um, it decreases the likelihood of us being able to cure the patient of the cancer.
I think, Doctor, you mentioned a lot of points there. I think number one, in the Philippines, I agree. And I think not only in the Philippines, when I had a podcast interview, also, Jordan similarly have the same problem that, healthcare is mostly out of pocket. A lot of people don't have insurance. So as a result of not having insurance coverage, then you resort to just going to the pharmacy and asking for medicine, even without, getting yourself checked by the right doctor. So I think it's entangled, right? The healthcare, the lack of funds for that, the late diagnosis is all a reason. Now, doctor, if a person wants to travel to get themselves treated, right now we live in a world where if you want to go treated in Canada, in US, in India, you're always wanting the best healthcare but the most affordable option. Now, I spoke about the Philippines from your experience, doctor. How unique is our healthcare in terms of what you have seen in other countries?
Before I answer that question, because you mentioned about insurance,
Yeah.
one of the challenges of people here in the Philippines who have insurance coverage is that the amount of coverage is actually very small. The
Mm.
typical coverage of people here is between 100,000 to about 300,000 pesos. If you have 300,000, it's going to be um, I cannot say significant help because that amount is still small, but it's still substantial. However, if your insurance coverage is only about 100 to 150,000, that's actually very small. Because the management for cancer is very long. It usually involves about 6 months, and 100,000 is not going to get you very far in terms of healthcare costs. Now, Philippines is trying to struggle towards uh, applying a universal healthcare. But honestly, I think the Philippines is not. It's going to take a very long time before we can truly apply a genuine universal healthcare. Because when we talk about universal healthcare, my definition of a universal healthcare is something similar to the European countries and in Canada, wherein the government is like a
Mm.
um, uh, single payer entity for healthcare. In order for us to get to that point, I don't think our healthcare infrastructure is sufficient. Although, I'm not involved in policy, this is only an opinion. I have not conducted any study regarding this. But based on my experience, because my practice is here in Metro Manila, and we have patients who come from the provinces who tell us that imagine some patients will have to travel 8 to 10 hours from the province just to get healthcare in Metro Manila. I don't think there is I don't think if you can get the same quality healthcare that you can get here, you are not someone who will travel that far or sacrifice the travel to get to Manila when you can receive the same quality of healthcare in the province. So, um, all, I mean, it's very good that the Philippines is moving towards applying a universal healthcare, but um, it's going to be very, very far from. I'm not even going to use the word perfect. It's going to be very, very far from being even just adequate. Uh, the Philippines has a very huge population, and I don't think we really have the infrastructure to be able to carry that out.
I agree with you, doctor. I think we spoke about the problems on the lack of healthcare coverage, the huge healthcare cost that comes when you get sick. Now, even the coverage itself is a challenge, right? Like you said, in the Philippines, only 100,000 to 350,000 pesos, right? That's really low. I mean, I think what's good that I've seen, like in Dubai, it's mandatory for all employers to make this sure that they're, employees are insured as well as the families of those employees. And I think because of our population challenges, that remains to be a challenge. But I think one of the advantages, though, is that if I am from a first world country, or if my insurance has a big coverage, then I can go and go to the Philippines and get treated, or go to India and get treated, because that way, because of the cheaper cost of treatment and medication, it could be, your coverage insurance would be longer if you go to these kind of countries. Have you seen doctors, specifically some foreigners? Because I remember when my mom was in the hospital, some Filipino nurses were telling me, just bring your mom to the Philippines. We have the best doctors in the Philippines too. I mean, I know Filipinos would always prefer Filipino doctors as well. Now, have you seen also in the Philippines some foreigners going to get themselves treated?
Yes, there are some patients who do that, but the challenge with that is that their insurance need to be accredited with particular hospitals that they will be going to.
Mm.
Not because you have insurance, for example, abroad, and because you would say that treatment here in the Philippines is can be cheaper, doesn't mean that you can just automatically transfer to the Philippines. There is that barrier of accreditation of your insurance in the hospital. For example, I'm practicing in St. Luke's Global City. Not all insurances are accredited by our hospital.
Hmm.
Now, if your insurance is something such as there are insurances wherein when you get sick with a critical illness, and cancer is an example of that critical illness, you get a lump sum of money. So if that's the case, then you bring cash to the Philippines for your healthcare, then no problem. We can actually treat you. You can actually go to any hospital and have yourself treated. By the way, I would like to add, Wanda, to the question earlier about the HMOs. Most of the local HMOs have an age limit of coverage. I think majority of the HMOs, of the local HMOs, will no longer cover patients beyond 65 years old. Some insurances will go as far as 70 years old, but um, even if the person insured has been enrolled with the insurance way before they develop certain illnesses, I believe that I hope that I am wrong, but this has been my experience that patients, when they reach the age of 65 to 70 years old, are no longer covered by the insurances. And naturally, that is the age when most people actually get sick. So that's another challenge, no? With regards to healthcare in the Philippines. Um, so it's really very challenging. Cancer is not called the big C for nothing. Aside from the burden of being labeled as somebody who has cancer, it involves emotional. There is an emotional, psychological component to the diagnosis. There is that financial aspect of the disease. And so being diagnosed with cancer can really be extremely burdensome.
I think I agree with you, doctor. The burdensome word. I mean, the big C is the big C for a reason, right? And I think when it struck my family, it's really like a total shock in many aspects, mentally, emotionally, physically, financially. That's why I brought this podcast to life because the goal is to have experts like you to shed light that way. This big C is a burdensome, and this is how you'll manage it. And I think you brought a very good important point there that yeah, you might have a big coverage of insurance, but if it's not accredited in a country where you're going to, then that's something that you need to check. Or if you do have a lump sum amount that you can get, then I think in anything that you do, it's all about the due diligence, right? Do you have insurance? Where does it cover? How much is going to cover, what countries, what kinds of treatment. It's very important to talk about these pointers. Now, doctor, I want if you can share. I read one of the articles that you have in the Philippine Daily Inquirer where you said that I really love those lines that you mentioned in that article where you said you believe that cancer management is not about pushing one treatment one after another. It's not about introducing new technology and developing and depleting the resources of the family. It's about coming up with a plan that will balance the need to prolong the patient's life and preserve the dignity of the family and the patient. Can you expand more? Because what I've seen here, I mean, I've met many cancer patients in the hospital, and they're into this journey of, okay, I finished this treatment, it's not working, it's spread, I'm gonna do another treatment, right? And I think it's a question of when do you really stop? And can you expand more from your 20 years of experience? What's really the best way to take the big C altogether?
Yeah. Um, the context of why I said pushing one treatment after another is because in patients with stage 4 cancer, um, majority of the treatments that are available, even in other countries, is not likely going to cure the cancer. I'm not only saying it because I'm a cancer doctor practicing in a third world where resources are always a challenge. Even if you go to the United States, in the UK, in countries wherein healthcare is socialized and given equitably by the government, patients with stage 4 cancer, majority of them will not be cured. So does it mean then that you don't undergo treatment? Of course not. The medicines that are available nowadays are able to prolong patients' lives, but that is most of the time at the expense of going from one treatment to another. Because any effective treatment that has been FDA approved, presented to you in a advanced hospital in a foreign country, can only provide control for a certain number of months or years. It's good that nowadays we have newer medicines, like, for example, Tagrisso, that provides very excellent control of the disease with very minimal symptoms. But still, those medicines are not very common in oncology. So, usually after some time, because cancer is a very, very intelligent disease, it always tries to find a way to evade the activity of the drug that a patient is receiving. That is the job of cancer, to be able to escape or develop resistance against the current treatment. No? So that the role of cancer is to keep on surviving. To keep on surviving, and therefore, it has a very high likelihood of undergoing mutation. And when that happens, it eventually develops resistance, no matter how effective the medicine has been previously. So when a patient develops resistance, and we can see that if, for example, the patient's initial cancer increases in size, spreads in different location, or increases in number, multiplies in different areas, these are some of the signs that the cancer has already developed resistance to the current treatment. And what the doctor does is to shift the treatment from one protocol to another. Okay, here in the Philippines, many of the patients, by the time that they get to the healthcare system, their bodies have already been worn down by cancer. Many patients have already lost a lot of weight. Many patients are not the ideal or very good candidates for treatment. And so sometimes, they move from one treatment to another and without response. Um, uh, Here in the Philippines, or in my practice at least, the first order for the day, whenever I get a new patient, is to have a family conference, to have a discussion with the family. In almost all instances, even if the patient is aware of the diagnosis, I offer to the family for us to have a meeting without the patient. No? So most of the time when I message my patients asking them to meet me, and when I tell them without the patient, I always need to tell them that there is nothing to worry about at this time. It is just that I routinely offer this space for the family to talk to me without the patient, because I believe that no matter how, how honest a patient is in saying that I understand my condition, I want to know everything about it, I am sure that the family always have questions that they wouldn't feel comfortable asking in front of the patient. And I want to be able to provide that space. Another thing, cancer is a disease that really takes up a lot of family resources. Family resources, logistics, time away from work, and cancer is actually a disease or a condition that can actually bring out a chaotic family environment or family dynamics. No? So this is when the children can start quarreling with one another, and because most of the time through the course of cancer, the healthcare needs, the supportive needs, the caregiving needs can potentially increase over time. And I want to be able to prepare the family for that. Um, so um, because for me, understanding what's ahead equips you with the ability to prepare. So it becomes very difficult when you know that you have a challenging situation, and yet at the same time you don't know how to deal with it because you don't know what's going to happen. Of course, we cannot promise the family that we can lay down everything exactly as I have told them, but I have, found in my practice that there has actually been almost no family that did not take my offer to have a discussion with them. And um, I can sense that it gives, some sort of comfort knowing what lies ahead, because it gives you the ability to prepare rather than, going blind to a war and you don't know what you're up against.
I love that explanation, doctor. I think that for me is quality care, because I've met many doctors and sometimes doctors are in a rush, you meet them, but they will just be limiting to, okay, you can only ask this question. But I think what I love what you said here is that you really take time to talk to the family, discuss and, answer any questions that they have. Because I agree with you. I mean, as a caregiver, I know there are many dynamics, many questions that you want to ask, but you don't want to ask in front of the patient, right? And I think this is where quality care, puts into equation that you need to be prepared in the big C battle that your family needs to battle together. Now, doctor, what could be your best advice? Because at the end of the day, it's about giving the best quality care, right? Without breaking the bank. What's your best advice to those people if they want to get the right help without breaking the bank? What's the best way and the best guidance, and even how to find the right doctor for them? How do they do that?
Um, well, sadly, I don't think there's a way that you will be able to get quality care without really breaking the bank. But there can be some strategies to be able to mitigate the financial impact. Well, unfortunately, here in the Philippines, um, the financial assistance is something you can get financial assistance, but the financial assistance will not be able to take care of the total amount that you need for the healthcare. And the other challenge is that it will involve, the patients having to queue up for certain government agencies. It can really be a struggle, but there are ways that uh, can help, families be able to at least get some sort of assistance. So you combine all these things to help finance healthcare. But yes, no, I mean, there are no words to try to hide the fact that healthcare is going to be expensive, and I am sadly not confident that within my lifetime I will be able to see a truly universal healthcare system in the Philippines. Um, uh, Second opinion can involve some costs, but one of the important things is that you have a rapport with your doctor. You need to feel comfortable with the doctor who is managing the patient. Of course, that is not to say that qualifications, um, you should also be able to check that your doctor is a member of the society under which that specialty operates. That the hospital is also reputable. Um, uh, and if you don't feel comfortable with the recommendations being given by your current doctor, you are actually free to get a second opinion. So, and try to gauge which doctor are you more comfortable with. Because at the end of the day, um, it's a very emotional disease. It's a very
Mm.
emotional illness, and if you cannot get that emotional support somehow, it's going to be very difficult. And also, that is not to say that some doctors are simply better than others. No, it's not. People have different personalities, and personalities jive. Even if, for example, you may feel that you are impressed with how I explain things, there are some people who don't like me. That's the reality, no? Uh, it's about when I refer patients to other doctors, I in my mind I try to evaluate who is the doctor that I know that will suit best for this patient. So that's also true when you are doctor shopping. It's okay to doctor shop as long as you give yourself a certain time frame. Because I've encountered patients who shop from one doctor to another, and it has already been several months, the condition is worsening, and they're not doing anything about it. And whenever they go to the next doctor, they simply complain. So that's one of the strategies that you can apply to, try to find the best healthcare for you.
I love that explanation. I mean, I've been doctor shopping, but I think it's it's not doctor shopping for me. It's like, I'm always like listening to this doctor and then validating to the other. I think as you rightly said, it's not a there are different patients, different doctors, and the one that can give you that, need the rapport that you need, the emotional, support that you need is very critical in anything. Now, doctor, you shared a lot already, and I think maybe just one story of, can you share one patient story that you will not forget?
There are a lot, but there are a lot, but I also want this to be educational. No, this story I want this to be educational to people. Sadly, cancer pain is very common in the journey of a cancer patient. In literature, it says that about 75% of patients may experience severe pain along the cancer journey. So many years back, uh, a guy, a male patient in his mid 60s consulted me because he was diagnosed with lung cancer that was already advanced. When I first saw this patient, he had a very huge mass here in front of his chest. The cancer has already, protruded, going outside. And because it was already infiltrating the bone, it was causing him severe pain. So when I saw this patient, he looked very grumpy. His face was, like this. Um, and when he saw me, he was not particularly happy to see me. I felt like he wanted to tell his wife, let's go. This is not going to help. But he stayed on. So we had a consultation, and in almost all of my consults, whether it's a new or an old patient, after getting the history, one of the questions that I ask is, "Are you in pain?" Because we know that there is a very high chance the patient could be experiencing some pain, and it will be very difficult to get the compliance of the patient who is uncomfortable and in pain. And therefore, we need to address the pain regardless of whether or not we have already proven the diagnosis of cancer to be true. So for this patient, just after taking a brief history, I did not ask for anything else, but I prescribed to him pain medicine. So that was the only order for that consultation. When I saw this guy, the chest was open, his hair was not combed, and his face was, like this. So I, sent him home with pain medicine, with the proper instructions, and asked them to come back about a week later. And when I saw this guy during the second consultation the following week, he has already combed his hair. He was already smiling when he saw me, and he was actually more conversant. So, um, a lot of people are actually afraid of taking opioids or morphine. I'm not advocating for anybody who is in pain to just be haphazardly taking opioids or morphine. But when a patient is legitimately diagnosed with cancer, we must not be afraid to use that. In the Philippines, it is a very common notion to reject the prescription of morphine because people think that if you have or if you are taking morphine, malala, no? Or in English, you have a very severe condition that scary. Okay? Uh, Morphine and other opioids are a legitimate medicine in the management of cancer. Yes, there are side effects. I'm not hiding that because part of our consultation should involve me educating the patient and the family about the potential side effects and give management that will mitigate these side effects so that when we weigh the risks and benefits, the benefits will stand out. Okay, so I've seen so many people who are suffering in so much pain only because either they do not want to take the opioids or morphine, or sadly, some doctors are not familiar with how to give that, no? Because that medicine requires a special prescription from the Philippine Drug Enforcement Agency. Not all doctors can actually prescribe these regulated medicines. And in fact, if the uh, law enforcement authorities, catches a person bearing morphine without a concomitant prescription, that person can actually be put to jail or be accused of, drug use,
Mm.
illicit drug use. Okay,
I,
but
I
but
think, yeah, I think, Doctor, what I like about this story is how you're able to understand the pain, and give him that medication that he needs. Because I think that's the most important thing that I think is relevant when you consult any doctor or any medical practitioner, right? I mean, a person who understands you, right? Even without saying a word, and gives you the whatever you need is the one that's best for you. And I think in this scenario, you saw the person in pain and you give the prescription. And I think that's the other thing about the big C. It's about, do I take, there's always the fear of, when I take the medicine, what's the side effect of that? There's so much fear around it. And I think the good thing about this is, like what you said, you educate those, people, what are the side effects when you do take those medicine. Now, doctor, we covered so much already. Any last few words of advice, if people want to, avoid cancer or to cure cancer early, what's your best advice to them?
um okay, this is something that if you really are serious, it's something that you need to study. You need to study and learn, because there are so many factors. It will not be possible for me, to just share tips with you and then voila. No, it's not going to be like that. You need to learn because, as simple as our cosmetics can actually be considered as endocrine disruptors. And breast cancer is actually the number one cancer in female, and prostate cancer is the number one cancer in males, and these are all endocrine related cancers. Okay, so you need to be diligent in trying to find out, um, and be serious about it. Cannot be that now people will always ask me, what should I eat to prevent cancer? No, it's not like that. It's about taking some and avoiding a lot. There.
Thank you, doctor, for those very straight words. Now, doctor, we are would like to personally invite, people, if they want to consult with you, what's the best way to do that? And I will always say it's the best way to get second opinion. It's the best way to get the right help. Now, if for those people who want to consult you online or face to face in the Philippines, can you please share with them what's the best way to do that?
Um, uh, You can actually get in touch with my secretary even if you are abroad. You can actually get in touch with her through Viber, because Viber is actually the most common means of communicating here in the Philippines. I believe that in Dubai is it WhatsApp. So
Yes,
here
doctor,
in the
it's what's up
Philippines,
here.
yes, here in the Philippines it's actually Viber. Philippines is actually an OFW country, so many of our patients actually have relatives abroad. And even before the pandemic, I have already been getting in touch with relatives who are abroad. Um, uh, I have been starting chat groups with patients' families because I understand that it's very difficult for example, a son or a daughter who is abroad, knowing that a mother or a father has been diagnosed with cancer. It's really going to drive you crazy. So, as a courtesy to the family members, I would always encourage them to create chat groups so that they can ask questions directly to me. Because most of the time, if for example I just explain to the family member who is left here, sometimes by the time that they relay the information to the other relatives abroad, a lot of information has already been changed. So,
True.
so actually, that is one of my forte and what I would call I'm good at. Um, my patients have told me that, for example, if some of these patients have been managed by other doctors, either here or abroad, when they get to chat with me, they would most of the time tell me that this is the first time that we got to really understand the situation, and I think that's my God-given gift that I would like to be able to share with more people. No, so one of the reasons why I agreed to have this talk with you is because I want to be able to reach out to more people. You don't necessarily have to transfer to my service, but I may be able to help you understand what's going on because you know cancer management is very long, it's very complicated, and most of the time we really have to move from one treatment to another. So one of the ways for you to mitigate your costs is, probably the family has already decided that this kind of treatment is not going to be cost effective for them. So there's no point in having to force the patient to have to go through that treatment when they already believe that, for them, values is one of the things that is very important in decision making, in treatment decision making. So it's one of the things that I always integrate into the discussion. So if you are having family members with cancer and you are confused, you don't know what's going on, you can get in touch with my secretary. Um, are you going to post the name and
Yes,
number of
doctor, we're going to flash the number of your secretary because I
yes?
think,
So
throughout the interview, I can sense. I can sense how much. I think I agree with you in many aspects. Cancer is a complex journey and you need a lot of clarity and guidance. And, you need that somebody who can explain to you what's now, what's next, what's the right thing to do. And I think, every person have their own preference, but I think for those Filipinos overseas, whether they want to get treated in the Philippines or whether they have some family members that need help, I think it's good, to have conversation with you because that's really, for me, that was life saving to have somebody, who speaks the same language, who can answer every question that I have. So, doctor, thank you again. We will put all your numbers. Doc Denky have 19,000 followers on TikTok, and she has a lot of educational videos. We will drop all her TikTok links here. Please, please do follow her. Well, we are very blessed to have Dr. Denky on stage. We are very blessed to talk about cancer care and cause and treatment. I think I agree with doctor on many ways. Number one, cancer is a big C. Big C is very scary. But if you do have the right people, the right help, the right support, the right doctor for you, then it's good to have that right. Number two, healthcare cost for cancer is a very complicated too. So getting the right guidance, doing your research, because you can have insurance, but it might not be sufficient for coverage, or you might have a big coverage, but you need to understand the complexities with your hospitals too. And if you want to get in touch with Doc Denky, I will always say a second opinion is not harmful. It's actually very helpful in many aspects. And I think as a family, and if you do want that clarity, that confidence, how to take the big C altogether, it's very, very good to get in touch with doctors like Doc Denky. Thank you for those who are watching us live or on replay. Again, this is Wanda 𝐀𝐿𝐿. I'm the host of the Cancer Conversations with Coach Wanda. We would like to partner with you as our guest or as our sponsor if you want to help us join in this mission to give life-saving insights to prevent, detect, and cure cancer. Thank you. Tune in to the next episode. God bless you.